So in this tutorial, we are going to visualize classification of bacteria according to SchrDbb. Now, for the classification of bacteria according to SchrDbb, you need to classify bacteria into three. The first classification group, we are going to have the gram stain. That is the first classification group of bacteria. The second classification group of bacteria, we are going to have the Zell-Nelson stain. And I've forgotten also to speak about fungi as being one of the microorganisms in the causative agents. Please, fungi are also one of the microorganisms in the causative agents. So here the feed point so we've said viruses, we said bacteria, we said parasites, we said prions. The fifth one is fungi. Don't forget to write it. Now let's visualize the classification of bacteria. For classification of bacteria, we have the gram stain, we have the Zell-Nelson stain, and we have other classification. So gram stain, Zell-Nelson stain, and other class. Now under the other class, we have one which are the intracellular bacteria. We are going to have two different morphology. So we have intracellular bacteria and we have different morphology. Now under the different morphology, we have comma-shaped cells. We have comma-shaped cells, and we have spiral sheets, and we have also a helicobacter. So those are the different shaped cells, different morphology, which are still located under the other class. And then we have still others among this class here. So the ones that I have not mentioned in this is going to be in this other class. Now, under the gram stain, you need to divide it into two. You have gram positive bacteria and you have gram negative bacteria. Under the Zell-Nelson stain, we know already that is going to be the acid-fast bacilli. Under the Zell-Nelson stain, we have the acid-fast bacilli. Now, still under the gram stain, we are going to have aerobes and we are going to have anaerobes. And for the gram negative, still the aerobes and anaerobes. So that is the peculiar classification that you have to work with. This classification is going to be enabling you in order to know which antibiotic you have to use when you have a particular infection you are thinking of. So those are the things that you should put in mind. Now let's visualize now the first one, which is for the gram stain. Now for the gram stain, I initially said that you need to divide it into two. You need to divide it into gram positive or you need to divide it into gram negative. Now for the gram positive, you need to know that what it is still divided into aerobes, gram positive aerobes, and divided into gram negative, the gram positive anaerobes. And in the case of the gram negative, you divide it into the gram negative aerobes and you divide it into gram negative anaerobes. So that is a simple division according to SchrDbb that you have to do. Now under the aerobes, what are the microorganisms which are gram positive and they are also aerobes? So the first microorganism which is gram positive aerobes, we have the Streptococci. So the Streptococci family. So all the Streptococci family are under the gram positive aerobes. Now inside the Streptococci family, you need to know that there are divisions under the Streptococci family. The Streptococci family is made up of the group A, B, C, D, E, and even F, G. It's going forward. But the most important that you have to know is group A, group B, and group D. Those are the most important ones. Now, among the group A, we have what is called the beta and the alpha hemolytic cells. The beta hemolytic cells are the ones that are going to cause a hemolysis by disruption of the beta globin chains of hemoglobin. While the alpha hemolytic cells are the one that are going to result to the disruption or cause hemolysis by disruption of the alpha globin chains. So when they say group A beta hemolytic, it means that they cause hemolysis by disruption of the beta globin chain. And when we say alpha hemolytic, it means that it's going to result to hemolysis by disruption of the alpha globin chain. Now, the most important one among both of them is going to be the beta hemolytic. So we take an example which is the group A beta hemolytic. So group A, among the example of group A beta hemolytic, we have Streptococcus pyogenes. Is it clear? So this is an example of the streptococci under the group A beta hemolytic. Now we continue now with the group B streptococcus. Is it clear? So we continue with the group B streptococcus. So now under the group B streptococcus, the first one that we have under the group B streptococcus, you have Streptococcus pneumoniae. Is it clear? Streptococcus pneumoniae is a very common cause of pneumonia. Streptococcus pyogenes mostly cause skin infections and causes upper respiratory tract infections. And this is the most common one that is associated with the post-streptococcal glomerulonephritis. In skin infection is going to result to furuncles and impetigo. Is it clear? An upper respiratory tract infection can result to tonsillitis, though tonsillitis most commonly caused by viral infection, but it can still result to tonsillitis, particularly if it is suppurative, and can also result to pharyngitis, particularly if it is suppurative. This pyogenes at the end just means that it is resulting most of the time into pus. Now let's go to group B streptococcus. In group B streptococcus, you have Streptococcus pneumoniae. The second one is Streptococcus agalactiae. Is it clear? Agalactiae. Now Streptococcus agalactiae now is the most important one involved